The objectives of this presentation, we basically have to discuss some of the commonly baby killers, and we'll discuss some of the basic terms and management. So I'm not going to go into the detail of every emergency, but I'm going to try and cater the basic ones which we are commonly finding in our emergencies. So non-accidental injury, which is the first emergency which we find, is the most commonest cause of an infant death outside the neonatal period. Now, it may be because of a caretaker. In 90% of the cases, the caretakers are the abusers, which can cause his non-accidental injuries. Now, the signs, what are the signs of non-accidental injuries? Number one, they are intoxicated. The caregivers may be intoxicated or high, inconsistent or implausible history, persistently crying baby, irritable baby. That may be one of the reasons of a baby suspecting with an NAI. Multiple or different age fractures can be there. Posterior rib fractures can be there. Unusually shaped or distributed bruises or burns, bite marks. So these are all the signs which we can look into once a baby is in the emergency. Head injury is the leading cause of death in the non-accidental injuries. The initial neonatal examination will be normal. You will not find anything except that the baby has been crying continuously and is not inconsolable even after the baby has been fed. The baby will not feed the mother as well what the baby did. Then there will be an altered LOC, irritability, like I told you, persistent vomitings. The baby may present with seizures, and there may be a decreased muscle tone. We may find some retinal hemorrhages which are virtually pathognomic of an NAI in a neonate. So if you can, I have just put this slide from one of my patients. You can see the retinal hemorrhages which are very clearly visible. So what I mean to say is, whenever a baby comes to you in an emergency who's irritable and is inconsolable, continuously crying, and you find that all the clinical parameters are fine, then you first of all suspect whether the baby is having any trauma or not, regarding the fact that you have to check if there is any fractures or any other bruises, bite marks, and then get a further management done.